Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at kinakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matiyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to vac up. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at kinakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to vac up. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall lead the light and lead a path to wisdom. Our will to be our lives. To those in pain and suffering, we shall hear a call. With arms to care and comfort from Master above all, to face the brighter future, found in unity. The Philippine College of Physicians, we shall be hand in hand, building a stronger nation. This is
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Philippine College of Physicians. Our topic for today is brain care for the young and not so young. Paano ba natin aalagaan ang ating mental health? Maraming salamat sa regular viewers, sa continuous support mula sa aming media partners, sa PCP members at sa mga masugid na tagapagsubaybay ng Philippine College of Physicians social media. I'm Dr. Francis Gail Teralba, member of the Media Communications Committee. I will be your moderator for this health forum. But before we start, let us hear a welcome message from Dr. Regina Burba, an incumbent member of the Board of Regents of the Philippine College of Physicians. Good morning, Dr.
Good morning, Gail. Good morning, everybody. Malugod naming binabati kayong lahat. So, according sa WHO, health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Ibig sabihin, dapat malusog yung kabuuan ng ating pagkatao, no? So, mental health is as important as physical health. And it was also further defined by WHO as a state of being in which one person realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make contributions to his or her community. So, hindi lang malusog tayo, kailangan kayang-kaya natin gawin itong mga sinabi ng WHO. So, the importance of mental health was specially highlighted nitong pandemic. This is the reason why we are especially grateful to the Philippine Neurological Association for this very relevant and timely collaborative webinar with the PCP entitled Brain Care for the Young and Not So Young. Our sincerest gratitude po sa mga speakers natin. So in behalf of the Board of Regents, we welcome you all for another learning episode which will surely enrich all of us. Good day, everybody.
Thank you very much, Dr. Burba. So to educate us more, we have invited an expert speaker who will update us on what we need to know about how to take care of our brain. It is an honor to introduce our speaker. He graduated medicine from the University of Santo Tomas. He's a fellow of the Philippine Neurological Association and a member of the Philippine Medical Association. He is a practicing consultant at the Jose Reyes Memorial Medical Center, Department of Neurology, and Capitol Medical Center. Let us all welcome our distinguished speaker, Dr. Steven Villarasa. Good morning po, Doc.
Hello, good morning. Magandang umaga po sa lahat. Share ko lang po yung slides to. Okay. Alright. So, once again, magandang umaga po sa lahat. Unang-una po sa lahat, nais ko pong pasalamatan ang Philippine College of Physicians para sa pag-imbita sa akin para maging tagapagsalita ngayong umaga. So, ang topic ho natin ngayong umaga ko ay ang tungkol po sa brain care. Para po sa mga bata at sa mga hindi na bata. So, alagang utak para sa lahat. So, ang unang-unang natin munang kailangang talakayan, no? What is brain health? So, brain health is a state of brain functioning that allows, again, no, a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. So iba ho ang brain health sa mental health, no? Ang mental health ay more of state of well-being para mas maging resilient ka sa pag-handle ng stress, para matuto ka, para makapagtrabaho ka. Ang brain health focuses more on the physical brain integrity, yung integridad ng brain at ng mga nerves ninyo. So yun po yung focus natin ngayong umaga. So para maalalayan po tayo, I try to summarize yung mga different recommendations from the different organizations and the institutions on how we can promote brain health. So we can summarize it into 9 important topics. No? First is yung neurovascular risk management. Second would be physical activity. Third will be sleep. Fourth, nutrition. Fifth would be digital exposure. Sixth would be yung vices. Seventh would be social activity. And eighth would be cognitive stimulation. So we'll be going into deeper detail at each of these domains para to discuss different ways on how we can promote brain health. So the first is yung neurovascular risk management. So recommendations would say that it's ideal that the blood pressure targets should be less than 130 millimeters mercury. No? The HbA1c should be less than 7%. The good cholesterol, yung magandang cholesterol ng HDL ho natin should be normal to high. And the low density lipoprotein or yung bad cholesterol should be normal to low. Ideally for the Asians, ang BMI or yung body mass index ho natin dapat nasa 18.5 to 24.9. So para makompute po yung body mass index, kinukuha po natin yung weight in kilograms po natin divided by the height in meters squared. So ito po yung mga general physical targets na kailangan natin makamit para ma-make sure that we have very good neurovascular risk management. Now, if we're able to control yung mga risk factors na tulad ng hypertension, diabetes, or cholesterol problem, and as well as obesity, this can give us protection or at least lower the risk for us for developing strokes. It can improve the symptoms of yung headache syndromes, control the symptoms of epilepsy, reduce the risk of developing or the progression of Parkinson's disease, neuropathies, as well as cognitive impairment. Okay, next would be physical activity. When we talk about physical activity, there are two types of exercises that we need to talk about. Now, first would be the aerobic exercises, and the other one would be strength training. So when we talk about aerobic exercises, what does the recommendation say? So the recommendations say that we should at least try to aim at least 150 minutes or 2.5 hours of moderate aerobic exercise per week. So pwede siyang 30 minutes every day or 2.5 hours, so 1 hour every other day. So yung moderate aerobic exercises would include exercises like mopping, vacuuming, walking outside, water aerobics, mowing the lawn. So these exercises are exercises that is enough to make you sweat. So that is how we can quantify that it is that is how we can quantify if it's a moderate aerobic exercise. Or we can also go for 75 minutes of or 1.5 hours of vigorous aerobic exercise per week. So when we talk about vigorous aerobic exercises, they are yung mga stationary rowing, stationary bicycling, or aerobics na high impact. So these are high intensity exercises. So if you're going to go for moderate aerobic exercises, that's around 150 minutes per week. If it's high intensity exercise, 75 minutes per week. Now, the other group of exercises would be the strength training exercises. And when we talk about strength training exercises, these are exercises that help improve the power and the strength of your major muscle group. So it is recommended that we exercise all our major muscle groups 2 days in a week, so twice a week. And one set should be around 12 to 15 repetitions. Okay, so again, very important, a combination of aerobic exercise and strength training exercises. So again, aerobic exercises at least 150 minutes per week together, in addition to at least 2 days a week of strength training exercises. So hindi pwedeng aerobic lang, hindi lang pwedeng strength training. It should be a combination of both. And if we're able to do these exercises, it can help improve for patients na merong stroke, to improve yung kanilang recovery or to prevent the recurrence of magkaroon ng stroke. For patients with muscle diseases, spinal cord diseases, improvement of Parkinson's disease, neuropathies, as well as preventing cognitive impairment and dementia. The next thing that we need to talk about is sleep. When we talk about sleep, there is really no magic number on how much sleep a person needs. Tatanungin sa akin, Doc, ilang hours pa kailangan kong tulog? On average, most adults would need around 7 to 9 hours of sleep. But again, this is not a hard and fast rule. For as long as pagkagising ho ninyo, pakiramdam ho niyo, refreshed kayo, then that is enough or adequate sleep. So sleep helps protect our brain in different ways. Number one, it helps us organize new information. Number two, it helps solidify our memory. It helps us to have more critical thinking. It clears out harmful toxins in our brain, helps regulate our appetite, keeps our body healthy, and more importantly, makes our thought process more efficient. So these are the benefits of sleep. Okay, that's why sleep is very, very important. Now, if there are, here are the things that you need to watch out for. If you have any of these symptoms, this could suggest that there is a possible sleep disorder. So what are these symptoms? If you have frequent snoring, persistent daytime sleepiness, leg discomfort before sleep, acting out dreams during sleep, frequent grinding of teeth, or waking up with a severe headache or aching jaw. If you have any of these symptoms, it's better to consult a sleep specialist to try to investigate what's the reason for these symptoms, if there's possible sleep disorder, and probably treatment can be given. Okay, because these symptoms can prevent you from getting a good night's sleep. Now, aside from checking for yung mga symptoms that will help you not achieve a good night's sleep, we should also talk about sleep hygiene. So sleep hygiene are activities or routines that can help ensure that you get a good night's sleep. So what are the things that we talk about pag-usapan natin ng sleep hygiene? First is setting a schedule. Try to as much as possible wake up or sleep at the same time each day. You can also exercise, doing light exercises 20 to 30 minutes a day, but we try to avoid doing these exercises before sleep. Try to avoid drinking caffeine, nicotine, or alcoholic drinks before sleep. And more importantly, avoid bright lights and loud sounds like your TV or handphone during sleep. So very notorious yan. When we go to sleep, nakatingin tayo sa cellphone. So the light actually prevents us from getting a good night's sleep by stopping yung production of melatonin in our brain. So that's why ideally when we go to sleep, the room should be dark. Now, if we're able to exercise yung sleep hygiene and to watch out for yung mga symptoms that can prevent you from getting a good night's sleep, this can help reduce our risk for developing stroke, our risk for developing cognitive impairment or dementia, improve the symptoms of vertigo, headache, as well as epilepsy. So a major topic that is usually talked about when we talk about brain health is nutrition. So when we talk about nutrition, now there are several recommendations on the recommended diet. Some would say it's the MIND diet, the DASH diet, or the Mediterranean diet. For this morning, we'll be focusing on the MIND diet, which is basically a combination of the DASH diet and the Mediterranean diet. We should also try to avoid yung Western diet, which is yung diet high in cholesterol, salt, and fat. So essentially, fast foods. We try to avoid fast foods as much as possible. And this includes soda, mga soft drinks. So those are mga notorious. So the MIND diet or the Mediterranean DASH diet intervention for neurodegenerative delay is one of the recommended diets for promoting brain health. So we'll be going in deep detail on the different recommendations. So this is just a summary of the recommendations for the diet. Now, the first one is at least 3 servings of whole grains each day. So, one serving of whole grain is amounting to around half a cup of oatmeal, quinoa, brown rice, or corn. As you can see, hindi ho dito kasama ang white rice. So, white rice is not really part of yung recommended na grain intake each day. So, ideally, here we have yung, we have yung brown rice, corn, or oatmeal. So half a cup a day is recommended. Next would be at least one dark green salad and one other vegetable each day. So yung green leafy vegetables, so one serving is equal to 1 cup of raw or half a cup of cooked green vegetables. So your green vegetables would include your spinach, kale, arugula, lettuce, bok choy, or mustard greens. So a good way to remember this is you need to have at least one salad every day. And that salad is composed of at least one green leafy vegetable and one other vegetable. So if you can have that every day, that would be a good target. So one green vegetable every day and one other vegetable each day. So one serving of vegetables, again, half a cup of cooked vegetables. So you have your asparagus, broccoli, Brussels sprouts, cabbage, carrots, cauliflower, eggplant, green beans, mushroom, onions, okra, snow peas, squash, bell pepper, sweet potatoes, and tomato. So again, one salad every day of one green and one other vegetable. So yun na po yung recommended salad, vegetable intake natin every day. Next would be berries. Now, berries at least twice a week. So one serving is equal to half a cup of berries. So we have your raspberries, your strawberries, blueberries, and your blackberries. So dito sa Philippines, I think marami yung strawberries. Now, for the nuts, at least 1 ounce serving of nuts each day. So 1 ounce or 28 grams of nuts every day is okay. So we have your almonds, your cashew nuts, your walnuts, peanuts, pistachio, cashew, and what else? Yeah, so yun yung mga different nuts that we can take. So at least 28 grams or 1 ounce every day is okay. For the beans and legumes, at least one serving or half a cup, 3 servings per week. So have your chickpeas, your mung beans, kidney beans, pinto beans, lima beans, and fava beans. So ang beans ho natin 3 times a week. So 1/2 cup 3 times a week. What about meat? So poultry at least twice a week. So one serving is around 3 to 5 ounces or around 85 to 120 or 142 grams of meat. So what is important here is that we focus on white meat and skinless meat. So ideally, yung meat na choice natin should be yung skinless na white meat, for the chicken. What about yung dark meat? For the red meat, same thing, one serving around 3 to 5 ounces per week, but not more than 3 servings per week. So this is applicable for beef, for lamb, for pork. So ito yung this is how much we should try to restrict yung restrict yung meat intake natin. So preferably if you're going to take meat, at least yung white meat. Now for the fish, at least once a week. So one serving is around, again, 3 to 5 ounces. What is important here is the way of cooking the fish. So we try to avoid fried na pagluluto. For the fish, ideally, we go for yung salmon, tuna, tilapia, yung cod or yung bacalao, mahi-mahi on dorado, or yung halibut or yung dapa. So fish, so I think if you're going to go for meat products in our weekly diet, we try to go for either white meat, skinless meat ng chicken, or fish. Next, for butter or oils, not more than 1 tablespoon of butter or margarine per day. If possible, we can go for olive oil instead. So 1 serving of olive oil is around 2 tablespoons, and we are allowed at least 1 serving per day. Now, what if wala po tayong olive oil? What are alternatives that we can use? So there are other alternatives in the market, such as your almond oil, coconut oil, grapeseed oil, sunflower oil, and even avocado oil. Pero I think olive oil naman is readily available. Now, for the cheese and fried foods as well as in fast food, as much as possible, again, avoid fast and fried foods. This includes potato chips. Sinabi natin kanina, vegetables are okay, potatoes are in the list, but potato chips are a big no-no. So we try to avoid potato chips as much as possible. Sabi nga, French fries is one of the most dangerous foods that we can eat for our body. As for the cheese, not more than 2 ounces or 56 grams per week. For pastries, sweets, less than 5 times a week. So as just with any other diet recommendations, yung sweet should be sparingly taken. Now, for the salt, sodium intake should be limited to around 2,300 milligrams per day. So 2,300 milligrams is around 1 teaspoon of sodium or salt per day. But if possible, if you can aim for lower than 1,500 milligrams per day, or that's around half a teaspoon, that is better. Okay? So this includes yung mga sauces natin, mga sausawan, no? Kasi very high in salt po sila. So included po sila sa salt intake po natin sa araw-araw. So again, this is yung summary ng Mediterranean DASH intervention for neurodegenerative delay, or the MIND diet. Now, when it comes to diet, we also need to talk about yung mga trigger foods, no? Especially for patients that have migraine disorders, for example. So chocolates, processed meat, salt, artificial sugar, cheese, and alcohol, or yung mga beer. Can trigger migraine episodes. And for patients with vertigo, we try to avoid caffeinated drinks, high salt, high sugar, and even alcohol. So very important that these foods are somewhat linked, no, to the episodes, no, trigger episodes for migraine and vertigo. So if you're able to avoid these foods, then they can help reduce the episodes of developing symptoms. So, what about, this is a common question, no? What about, Doc, mga food supplements? No? So food supplements are intended to correct nutritional deficiencies, to maintain an adequate intake of certain nutrients. Like for example, kung kulang ka sa calcium, no? If we need daily amounts of calcium and iron, then supplements can be given, no? To support specific physiological functions. Therefore, they are not medicinal products, and as such cannot exert any pharmacological, immunological, or metabolic action. So, ginagamit lang ho sila kapag may kakulangan sa diet natin, kapag meron tayong kailangang supportan, like for example, yung mga nagdadalang tao, no? Kailangan nila ng extra sources of iron, for example, and folic acid, no? And for our specific functioning, like for example, for athletes, no? Kailangan nila ng more nutrients. So, food supplements can be given, pero hindi po sila, ang food supplements, so, hindi po pwedeng gamitin gamot para sa kahit anong karamdaman. Hindi po yan talaga pwedeng pamalit para sa bakuna, para pamalit para sa ating mga kinakain, no? Pati pamalit sa mga maintenance nating mga gamot. Dahil wala ko sila talagang direct na action para pagalingin yung mga karamdaman na iyon. So, kapag sinubukan nating maggawa, no, yung MIND diet, and to avoid yung mga trigger foods, no? So for the MIND diet, we can reduce the risk of developing stroke, cognitive impairment, reduce yung mga symptoms ng mga neuropathies, specifically for may mga diabetes, no? Again, for the trigger foods, we can avoid the symptoms of vertigo, symptoms of headache syndromes like migraine, as well as epilepsy. Next would be yung digital exposure. So how much digital exposure should we need? No? So digital exposure has a lot of benefits for us. No? It provides connectivity, gives us real-time connection with anyone, anytime. It gives us a way for additional education, gives us access, no, to information, news, and learning, gives us opportunity to express innovation, ideas, and opinions. And of course, gives us a way for entertainment, no, access for us for vast range of medias as well as hobbies, para maaliw naman tayo. However, with the advent of yung rise of yung use of the digital devices, no, nagkaroon na ngayon ng isang new condition called your digital eye strain. No? So, ang digital eye strain, the most common symptoms would include eye pain, eye strains, headaches, dry eyes, back and neck pain, fatigue. No? And this is usually caused by poor lighting, glare on the digital screen, improper wearing of, improper viewing distance pag masyadong malapit sa device, poor sitting posture, and uncorrected visual problems. So what happens sa digital eye strain is that normally, sa isang minute, in a minute, maraming beses tayo nagbi-blink, no? Pero because of yung prolonged exposure sa digital device, no, nababawasan yung rate ng pang-blink natin. So what happens is that it can cause dryness of the eyes, and that can lead to yung tinatawag nating digital eye strain. So how can we prevent digital eye strain? So here are some tips that we can do. First is that we can follow the 20-20-20 rule. So ano yung 20-20-20 rule? 20-20-20 means that for every 20 minutes of looking at a device, we look away for at least 20 seconds looking at an object 20 inches away. So as hanap tayo ng isang object na malayo, tingin tayo doon for at least 20 seconds every 20 minutes. This is to allow our eyes na makapagpahinga, makapag-rest, na, and more importantly, para malubricate siya. We can also take regular screen breaks, no? Again, every 20 minutes. Blink your eyes more often. Ensure that you have proper seating position. Adjust the brightness of your device. Keep the screen clean as much as possible. Sa mga may mahihinay paningin natin, no? We can increase yung text size to make it bigger. If you're wearing glasses, advisable na suotin mo natin yun palagi. Use proper lighting when using gadgets. So avoid looking at gadgets pag masyadong madilim, and to ensure correct distance seating. So wag sobrang lapit ho sa mga devices ho natin that include cell phone and laptops. And kasama na rin ng television. So when we use properly, no, our digital exposure, it can reduce our risk of developing cognitive impairment. If we try to avoid yung overexposure, no, yung too much exposure on digital devices, we can prevent yung headache, yung digital eye strain, and reduce the symptoms then of patients with epilepsy. Next, we talk about yung mga vices, yung mga bisyo. So, ano ba yung mga kinaklasify natin as mga bisyo, no? So again, junk food, fast foods, no? Loud music, sedentary lifestyle, cigarette smoking, alcohol, as well as drugs. So we need to avoid yung mga bisyo na ho ito, lalo na yung mga alcohol, drugs, and smoking, because they are strongly linked with the development of stroke, no? Progression of yung mga headache syndromes, epilepsy, progression of Parkinson's disease, pagkaroon ng addiction, paglala ng memory or pagkaroon ng memory problems, and paglala din ng mga neuropathies, no? Mga injuries sa nerves natin. So we have to avoid yung mga vices na iyon. The next would be yung social activity. So we asked the question, no? How do I improve my social activity? Did you know that loneliness can affect your health in many ways, no? By decreasing your memory, increasing the risk for developing drug abuse, causing brain changes, no? Yung pagliit, pagdegenerate ng brain natin, can also cause heart problems, depression, and higher stress levels. So what can you do, no? What can we do to improve our social activity? First is that we can join, no? We can join clubs, organizations, sports teams, civic groups, political groups, and even religious groups. So maraming mga clubs na pwede natin salihan ngayon, no? For others, you can also try to volunteer sa mga pet shelters, hospitals, schools, and even senior centers. And lastly, we encourage you to connect. Not connect with other people through either phone call or video calls, as well as social media. But again, responsible and regulated exposure sa social media. So these are the ways that you can improve your social activity. And if we're able to do this, no, we can reduce the risk of developing cognitive impairment and dementia, as well as depression. So this is actually one of the things na nakita namin na was a really huge factor, no, over the pandemic. Ang dami nag-develop ng depression, anxiety, and memory problems because of the social isolation. Hindi sila nakakalabas, hindi sila nakakahalubilo sa ibang tao. So nag-worsen ang kanilang memory function, nag-worsen ang kanilang emotional problems. Lastly, we talk about yung cognitive stimulation. So, how do I exercise my brain? No? Basically, yun naman po yung purpose ng cognitive stimulation. So, one is that we can learn a new skill, no? Dancing, cooking, learning a new language, or even yung mga handicrafts like pottery. So, ang maganda ho dito, may mga pag-aaral ho tayo dito sa Pilipinas, no? Yung pagsasayaw ho ay nakakatulong para mag-improve ng brain health. Engaging in media, no, like watching movies, watching the news, reading fiction and non-fiction books. We can also promote yung creativity, no, by learning how to play an instrument, learning how to paint, playing competitive games or in trying yung mga puzzle games. So yun yung mga pwede ho natin gawin para ma-exercise ho yung brain natin. And lastly, to practice mindfulness and exposure to nature, no? Like meditation, praying, and even gardening, for example. So gardening gives you a good exposure sa nature, no? Provides you exercise physically, exercise mentally, lalo na kung nag-garden kayo regularly. So by doing exercises that will promote cognitive stimulation, promote cognitive stimulation, now you can reduce the risk of developing cognitive impairment as well as depression. So tatanungin sa akin dito, Doc, lalo na para sa mga matatanda na, yung mga hindi na bata, well, kasama na rin yung mga bata, mga bata, mga matatanda, yung mga elderly, no? Ano ba yung pinakamaganda na ma-recommend dito? I think it would be really dancing, no? Bakit? Pag sumasayaw ho tayo, number one, meron tayong physical exercise. So check na yung naka-check na yung physical activity natin na kailangan natin every day. Number two, there is thinking process required. Kailangan nating pakinggan yung music, kailangan nating sundan yung pagsayaw, no? So na-exercise na rin yung brain natin, no? So number 2 na 'yon. Number 3, meron din siyang social interaction. So meron na tayong way para makapag-interact, makihalubilo sa ibang mga tao, no? So ang kulang, kung titingnan natin, kulang na lang sa kanya diet. So isama na lang po natin yung yung salo-salo after ng pagkain. Of course, syempre yung salo-salo maganda, healthy foods, yung mga binanggit mo natin kanina. So by doing daily na dance, marami na ho natin mga targets ang pwedeng ma-achieve. And by that, we are able to promote brain health. So again, ito ho yung mga 8 na recommendations in summary, no? Yung summarized versions ng mga 8 recommendations on how we can promote brain health. So again, neurovascular risk management, physical activity, sleep, nutrition, digital exposure, vices, social media, social activity, as well as cognitive stimulation. So maraming kong salamat sa inyong lahat para sa pakikinig at handa na po akong sagutin ang mga katanungan po ninyo.
Thank you very much, Dr. Villarasa, for that great lecture. Very clear, informative, and interesting po yung lecture, Doc, no? We have questions coming in, but I encourage our virtual audience to continue to type their questions in the chat box. So, Doc, ang first question po natin, ano po yung age group na napapansin nyo na nagkukonsulta po sa inyo para sa mga problemang nagiging makakalimutin daw po?
Alright, okay. So surprisingly, before nung pandemic, most ng mga pasyente na nagko-complain ng mga memory problems na nakikita ko sa clinic, would be around age 65 pataas, yung mga elderly. But during the pandemic and even after the pandemic, napansin ko na mas dumadami na rin, or at least nagsisimula na rin na tumaas yung bilang ng mga pasyente na nagko-complain ng memory problems sa mga age 40 pataas. Okay? Likely because of yung mga psychological psychiatric conditions like anxiety, depression, which are risk factors din for developing memory problems later on. But more importantly, I guess yun nga yung sinabi ko natin kanina, during the pandemic, nagkaroon talaga ng social isolation. So, yung mga mild na forgetfulness, talagang lumalala sila kapag nagiging isolated ang isang tao. So, mostly yung mga walang nagagawa dati, yung mga during the pandemic na walang ginagawa sa bahay, doon nila mas napapansin na parang mas nagiging mabagal ako mag-isip, mas nagiging makakalimutin ako. So they become worried even more, kaya nagpapakonsulta sila. Pero yung mga patients na 65 and above, almost same lang din. Medyo tumaas nga din, kasi yung ibang mga patients na makakalimutin na or may mga mild na symptoms na ng dementia, mas lumala din during the pandemic. Because of, again, social isolation.
Okay
so
po.
that is one of the things na na-observe namin.
Okay po, Doc. Yung isa pa pong question, paano daw po mapapansin or malalaman kung yung kasamahan sa bahay, let's say a parent or grandparent daw po, ay mukhang kailangan na pong ipatingin sa doktor. Parang, di ba meron pong usual na makakalimutin, pero
Right.
ito, yung mas madalas po bang makalimutin, kailangan na po bang dalhin sa doktor? Parang,
Okay. So, I think ang kadalasang concern ng mga kamag-anak dito ay ang tanong na meron na bang dementia yung magulang namin or kamag-anak namin, no? So, ang dementia ho ay isang karamdaman na kung saan meron na talagang meron ng memory problems at yung memory problem na yon ay nakakasagabal na para maalagaan ng isang tao ang kanyang sarili, no? So, I think kapag kung dati halimbawa, no, kaya pang makapagluto ng pasyente pero ngayon dahil sa memory problems niya, hindi na siya makaluto ng maayos or hindi na tulad nung dati yung kanyang pagluluto, no? So, kapag meron ng mga bagay siyang nagagawa before na hindi na niya nagagawa ngayon at ayun ay dahil sa memory problem niya, I think that would be a good time para ipatingin na po sa doktor, no? Ang goal kasi natin ngayon is really to ma-diagnose kaagad ang mga pasyente na hindi pa umaapak sa dementia or nasa mild stage pa lang ng dementia dahil doon talaga nakikita yung pinakamalaking benepisyo ng pagsimula ng mga therapy or mga gamutan kung kinakailangan. So, mahirap kasi sa atin, I think sa Filipino culture din, no, na ang misconception na maling idea na ang dementia ay bahagi talaga ng pagtanda, which is hindi ho talaga yan bahagi ng pagtanda. No, hindi siya normal na bahagi ng pagtanda. So, siguro pag nagiging nababahala na kayo sa pagiging makakalimutin, ma-recommend ko na ho na magpatingin na ho kayo sa doktor dahil meron naman po tayong mga pwedeng gawin mga screening na memory test para ma-check, no, kung meron na ho mga senyales or sintomas ng dementia.
okay po, Doc. Meron po ba daw specific na screening? Ano daw po yung mga specific na screening or memory test?
So, dito sa Pilipinas na meron ho tayong ginagawa nung screening na pwedeng gawin ng mga neurologists or even yung mga trained na mga doctors, no, is yung MMSE or Mini Mental Status Examination as well as yung MoCA or yung Montreal Cognitive Assessment. So mga test ho sila, no, marang simple na 30-item test na may iba't ibang mga katanungan, tapos bibigyan lang ho kayo ng punto kada isang tamang sagot na mabibigay po ninyo. Ngayon may mga cut-off scores ho kami doon para masabi kung mukha bang meron talagang senyales ng memory problem or wala, no? Kung wala, then meron pang mga additional na memory test na pwede natin paggawa, no, usually sa mga specialty centers, pero kapag masyadong mababa na yung score nila, then maaari na po natin more or less makuha na may idea na baka meron na dementia yung pasyente, no? So yun po yung mga pwedeng mga screening tests na pwedeng gawin, no? Unfortunately, walang mga blood test na pwedeng gawin para masabi kung may dementia ang isang tao kasi ang dementia is a memory problem. So ang kailangan talaga nating suriin ay yung pag-iisip or yung thinking powers or thinking ability ng pasyente.
Okay po, Doc. Very clear po yung mga sagot niyo, Doc, na we encourage others to send in your questions. Pero, Doc, yung regarding yung mga test na ito, mata-download po ba to online or kailangan talaga pumunta kay doktor? Meron po bang English and Filipino version ng mga test po na sinabi ninyo?
Okay. So yung mga test po ito, no, ay binibigay po or ina-administer ho ng isang doktor. So hindi pwedeng kayo yung magda-download tapos kayo sasagot, no? Dapat may trained na doktor na ang magbibigay ho ng test na yon sa inyo, no? Para sa mga doctors naman ho natin, no, mada-download ho ito, no, sa online. We have yung Filipino and yung English version. For the MMSE, meron din ho dito sa Pilipinas mga validated na versions for the different dialects like yung mga Hiligaynon, Ilocano. So we have yung translated na validated na rin ho.
Wow, that's good to hear po, Doc, no? Hopefully, all over the Philippines po yan, no? Ma-administer.
I think ang recommendation,
citizens.
I think ang recommendation is, kapag 65 years old, kung kaya, wala naman, siguro ang mga test na to, pwede magawa ng doktor for around mga 5 minutes, 5 to 10 minutes, no? If you're handling patients, no, sa mga doctors natin, if you're handling patients na 65 years old pataas, no, you can do yung mga routine screening test nito sa clinic ho ninyo, and if mababa yung score, you can refer immediately kaagad sa isang specialist.
Okay po. So pwede po kahit po ang general practitioner, ang ating internist, or anybody, any doctor can administer it, or kailangan po kayo lang po mga neurologist?
I think any internist or any doctor in general can do it as long as they are trained, or at least alam nila kung paano i-administer yon, no? Pero if yung naman ho, yung MMSE and MOCA, meron naman ho silang mga online guides on how to administer yung test na yon, no? They can still administer it, pero again, usually if mababa ho talaga yung score ng pasyente, then there's a high likelihood na baka meron po talagang cognitive problem. In any case, maganda na rin kung i-refer po sa isang specialist like a neurologist, no, a psychiatrist, psychologist, or even a geriatrician para ma-manage yung pasyente. Okay, again, ang goal ho natin really is to try to catch yung mga patients at a mild or early stage kasi nandun talaga yung biggest benefit of treatment.
Yes, exactly po. We have a question from Facebook from Myra Valderosa. My granddaughter, who is only 3 years old, is diagnosed with frontal lobe atrophy. Is this treatable? What can we do?
Okay, sige. Unfortunately, hindi po kasi ako pediatric neurologist, no, sa mga adults po ako, no. So siguro ang mapapayo ko po diyan is unang-una sa lahat, ano po ang cause? So ano po yung naging dahilan nung atrophy or nung pagliit, no? Yung atrophy is yung pagliit po ng utak, no. So kailangan mong muna masagot diyan is ano po ang dahilan kung bakit nagkaroon ng ganoong findings, paano nagkaroon ng pagliit ng frontal lobe, no? Number 2, ano ang mga naging effect ng pagliit ng frontal lobe na yon doon sa development ng pasyente. Okay? Mahirap pong masagot yan sa kasulukuyan dahil syempre kakaunti lang po yung information na meron po kami, no? Pero depende ho, ang gamutan ho usually pagdating sa mga karamdaman, no? Ang gamutan ho ay depende ho sa sanhi. Okay, so for example, kung ang cause niyan ay infection, then baka kailangan magbigay ng antibiotics. Kung ang cause naman po niyan ay more of developmental, ibig sabihin, nung habang lumalaki siya, may kakulangan sa nutrients kaya nagkaganoon, no? So usually pag mga ganon, mahirap talagang ma-address dahil ang naging cause po noon ay during ng development ng bata, no? Or kung halimbawa ang naging cause po niyan ay injury or tama, no, sa brain, no? Then kailangan tingnan kung ano po yung naging cause ng injury na yon, and doon ko kasi magbabase ng gamutan na pwedeng ibigay. So unfortunately hindi ko po talaga masasagot yan ng completely, no, pero I hope na yung mga nabanggit ko ay makapagbigay sa idea kung ano yung pwede natin mga susunod na hakbang na gawin para sa pasyente.
Napakalinaw po talaga mag-explain ni Doc, no? Another question po, regarding COVID, meron pong nagkakaroon ng tinatawag na brain fog daw after COVID. Ano po ang masasabi niyo po doon at rekomendasyon ninyo?
Okay. So yes, no, I think that is something na medyo umuusbong na ngayon, no, nagsisimula na dito sa natin sa bansa natin and even worldwide, no, yung effects ng long COVID, no, so yung tinatawag na brain fog. So ang kadalasang nagiging sintomas ko noon ay parang mas bumabagal yung bilis ng pag-iisip, no? Hindi naman talaga siya purely memory problem, no? Pag memory problem, ibig sabihin nakalimutan talaga ninyo or hindi talaga maalala. Ito, mas natatagalan lang talaga na ma-recall ang isang information. Okay? So, sa kasulukuyan, wala pa talagang gamot para magamot ang brain fog na tinatawag, no? However, yung mga binanggit ko natin kanina, no, by promoting yung brain health, no, yung mga brain health, yung mga activities na ma-make sure na maganda yung integrity ng ating brain at ng mga nerves, maaring makatulong ho yun para at least siguro ma-cancel out or ma-control, no, yung sintomas ng brain fog. So malaking bagay ho dito ay yung exercise para to make sure na maganda yung circulation ng daloy ng dugo papunta sa utak. Number 2, yung diet. Kasi kung hindi maganda yung diet ko natin, no, maaring sumikip or pumangit yung blood flow naman papunta sa utak, that can worsen or magpalala ng symptoms ng brain fog. Pangatlo, malaking bagay ho yung brain exercises. Siguro kailangan nating tandaan na yung utak natin, no, ay isang organ ng ating katawan, isang bahagi ng ating katawan na kapag hindi natin ginagamit, lumiliit siya or humihina siya. So the more na ginagamit natin ng ating utak, the more na mas nagiging siyang efficient. Okay? Ngayon, habang tumatanda tayo, hindi natin maiiwasan na liliit talaga yung utak natin. Pero kung patuloy tayo nag-exercise habang bata pa tayo, no, kahit dumilit na yung utak natin, yung connection sa pagitan ng ating mga brain cells ay malakas pa rin, kaya hindi basta-basta nagkakaroon ng memory problems or hindi lumalala yung mga memory problems. So, kapag nagawa natin na mag-exercise physically, exercise mentally, maaaring makatulong ho yun para mabawasan, maibsan ang mga sintomas ng brain fog na dulot ng COVID.
Okay po. Malinaw na malinaw po, Doc. Doc, ito po, medyo na question, no? Totoo po ba na yung mga may trabaho noon na highly cerebral, let's say mga teacher, professor, mga doktor, sila po ba ay mas madaling magkaroon ng demensya pag tumigil na po magtrabaho? Kasi parang napapansin pag nag-retire na po, mas madali pong nagiging demented daw po. Meron po bang katotohanan yun?
Actually, magandang katanungan yan, no? Unang-una sa lahat, no, yung educational level, ibig sabihin, pag mataas ang antas na nakuha niyo sa pag-aaral, no, at least lagpas kayo ng high school, no, mas maganda yung protection na maibibigay ho noon para maiwasan ang pag-develop ng dementia. Okay? So, yung mga highly cerebral nga na trabaho tulad ng mga teacher, mga executives, ano pa ba? Isama na natin mga doktor, nurses, yung mga technicians, no? So, mga ganung mga trabaho ay nakakatulong para, again, no, form of exercise pa rin yun para sa utak. So, essentially, ang mga ganung mga trabaho, no, nakakabigay ng protection against sa development ng memory problems later on. Ngayon, ang nagiging problema dyan is, syempre, after mag-retirement, no, biglang bagsak yung level of activity ng kanilang brain, no? Hindi na sila ganun ka-active mentally, no? So, ang nangyayari is mas napapansin nila, hindi sa mas mabilis sila mag-develop, but rather mas napapansin nila na nagiging mas makakalimutin sila. Bakit? Before, kung isang teacher na nagtuturo dati ng math, no, talagang mga math na pang high school, math na medyo complex, mahirap. Dati nagagawa niya ng mas madali yon. After mag-retirement, napapansin niya parang medyo nahihirapan ako mag-compute ng math. Okay? So, mas napapansin nila yung mga kahit maliliit na memory problem. So, hindi sila mas bumibilis, no? Pero mas kapansin-pansin sa kanila yung memory problems nila, no? So, again, nagkakaroon po ng factor, nagkakaroon ng weight, no, na after ng retirement, kung wala na silang nagagawang activities para ma-exercise yung brain, again, pwede yun na magdulot ng patuloy na pagpangit ng memory function. So, para sa mga mga tagapanood natin na nagtatrabaho and soon to retire, no? I think ang mahalagang pag-isipan ho natin at this point in time is ano ang gagawin natin after natin mag-retire. Naka-stay na lang ho ba tayo sa bahay, walang gagawin, or meron pa tayong ibang mga activities na pwedeng gawin na pwedeng ipagpatuloy even after mag-retire tayo. Kasi I think, no, isa yun sa mga magdidikta kung papangit ba o hindi ang memory ninyo later on after nyo mag-retire.
Very good, Doc. Malinaw na malinaw lahat ng sagot. I wish we had more time, but that was a great lecture, great discussion po. Any final words for our audience po, Doc?
Okay. Again, no, ang brain health po ay very important, lalo-lalo na po dito sa atin sa Pilipinas, no? Marami na po mga pag-aaral na nagbibigay ng linaw kung ano mga pwede nating gawin, no, para mapanatili ang kalusugan ng ating isip. Okay? Ang kailangan na lang po ay really consistency at motivation mula sa atin, mula sa mga kamag-anak natin, mga kasama natin, no? To be honest, mahirap na based sa mga nakikita ko, no, mahirap talaga ma-push yung mga recommendations na yon kung nag-iisa lang ho tayo. So, I think ang isa sa mga strengths natin bilang mga Pilipino ay meron tayong mga kamag-anak, mga kaakibat, no, sa buhay, sa trabaho na maaring tumulong sa atin. And I think maganda na idamay din natin sila para sabay-sabay ho tayong makakapag-panatili ng proper brain health. So, benefit para ho sa atin, benefit din ho para sa ating mga mahal sa buhay.
Thank you very much, Doc. I'm sure maaanyayahan ka ulit. Salamat po sa pagtangkilik sa amin. So,
Maraming salamat din.
Thank you. Before we end, let us hear a final take-home message from Dr. Maritzi Erval, the President of the Philippine Neurological Association. Good morning, ma'am.
Good morning po sa inyong lahat. Thank you very much to Dr. Steven Villarasa. Steven, maraming salamat. Yung brain health po talaga should be part, no? Maintenance of it, improvement of it should be on top of our list sa priorities, hindi lang puso, hindi lang yung lungs natin. And on behalf of PNA, I would like to thank also PCP. Ito pong forum na ito ay natutulungan po yung aming mga advokasya para maipaabot po sa publiko, no? So thank you very much to PCP. And to all our attendees today, sana po malaging bahagi po ng mga reminders at learnings natin sa lecture ni Dr. Villarasa ngayon, ma-retain natin po, para mag-maintain po tayo ng ating malusog na utak, no? So to everyone today, thank you very much for your attention. A pleasant morning to all.
Thank you very much, Dr. Erval. Sigurado po ako marami tayong natutunan sa lecture ngayong umaga. Maraming salamat po sa ating speaker, Dr. Steven Villarasa. Ito po ang ating mga take-home message. Una, we can promote brain health by remembering the following. Neurovascular risk management, meron daw pong target na BP. Sa physical activity, may prescribed exercise. Sa sleep po, meron pong sleep hygiene na makakatulong sa pagkamit natin ng good night's sleep. Sa nutrition, merong mga recommended diet tulad ng MIND diet, Mediterranean DASH intervention for neurological delay. Sa digital exposure, may benefits naman ang digital exposure, ngunit may tinatawag na digital eye strain. For vices, may mga bisyo na kailangan iwasan to prevent the development of strokes. Social activity, malaman natin lahat na loneliness pala can cause decreased memory, depression, higher stress levels, and susceptibility to substance abuse. Sa cognitive stimulation, we have to exercise our brain by learning a new skill, engage in media, promote creativity, meditation, and dancing, and also gardening. So, maraming salamat po. Inaanyayahan lahat na umattend sa susunod na PCP Health Forum next Tuesday, December 13, 2022. Salamat sa pag-attend sa ating PCP Health Forum. Maari po panoorin na ulit itong episode na ito sa PCP Facebook page. Abangan po natin ang mga susunod na PCP Health Forum. Stay healthy, stay safe. Thank you po.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.